Nowadays, cell phones are so common as they become larger. People are manipulating them more using their thumbs to reach across the cell phone. And this is placing strain across those tendons that bring our thumb back out of the way so we can move on to the next letter. And it's actually these guys that we're talking about. They run within this compartment, and this is a tight covering that keeps it into place. So the repetitive motion back and forth causes some swelling. Perhaps you took a bang to the wrist, causes more swelling here. And these are trapped underneath this very thick covering. And every time you move your thumb or your wrist back and forth, these have nowhere to go but to continue to grind on this, and it becomes quite painful. Also, we see a lot of new mothers and some new daddies as well, constantly lifting the kid, perhaps wringing out diapers or changing. That repetitive motion, again, back and forth. Patients actually present thinking that they have a fracture. They think the pain is so severe, they don't remember a trauma, but they're convinced that they must have broken something. That's how much it hurts and burns and really pains them. So treatment options for this after a patient has been diagnosed. A conservative starts with activity modification, resting the wrist and the hand, preventing that repetitive motion, putting the phone down for a while, or modifying how you're maybe using dictation for a while to rest the thumb, and a thumb spike, a splint that immobilizes the thumb across the wrist that then keeps your wrist in a neutral position and prevents that stretching or bending of the tendons and further irritation. And if conservative measures fail, then surgical intervention is indicated, which involves a same-day surgery and a small incision directly over where the pain site is, and to release that compartment so that the swelling can be decompressed and those tendons can glide without obstruction anymore.